Hello, everybody, and welcome to another episode of the Roundtable here at mycountylink.com as we continue to take a look at interesting people, places, and events that occur not only here in Darke County, but also around West Central Ohio. Glad you could join us this morning. I'm Alex Warner, joined by Ty House today, and with us from Wayne Healthcare, we have Lauren Henry and Robyn Feitshans. So first of all, welcome, ladies.
Thank
We're
you.
glad to have you here.
Yeah.
And I want to start this off. You probably didn't know, today is National Donut Day. So we're going to start off. What's your favorite two donuts?
Eikenberry's chocolate long johns is my
And?
number one.
And?
So shout out to Eikenberry's. Number two, probably a blueberry glaze at Dunkin' Donuts.
Oh, wow.
Yeah.
Well, blueberry
This
grape.
come from our health.
Yeah.
Yes, we were talking about diabetes.
And I meant to bring donuts. I got it. Robyn, how about your favorite two donuts?
My favorite number one is Brumbaugh's apple fritters. Always
Yeah,
have to go
always
with
good.
those. The second one is anything with a maple frosting.
Really? Okay, you like that. That's the one that, you're one of the people that actually buys the brown frosting on it.
I do, yeah.
Okay.
That's me.
I always
yeah.
wondered who bought that. Now I know.
I'm one of them.
Ty, how about you?
Eikenberry's Long John's white icing, and then their Eikenberry's Persian with white icing on it.
Oh, okay. Yeah, and mine would be Eikenberry's Long John's, white icing with crushed nuts. And then the other one would be, I like sour cream donuts too. So anyhow, so you folks out there, happy National Donut Day here and so forth. Okay, let's get into talking a little bit. First of all, the background for Robyn and Lauren, a little bit of your background, and then we'll just kind of take it from there. So Lauren, a little bit about yourself.
So I'm the foundation director at the hospital, been there 10 years. Our foundation is the nonprofit side of the hospital. We have a separate volunteer board of directors, and we do the fundraising and assistance programs for our patients. We help with community education, healthcare education. We do AED programs. We're going to talk about a lot of that, but that is what I do at the hospital. I really love helping others and being creative in how we can help our patients in need.
Yeah, and a Greenville graduate.
Greenville
a little bit of that
And,
background.
and a Miami graduate.
Miami,
like Alex.
thank you, yes, thank you.
Yeah, I don't know. And so,
You got
Finley,
how many kids now?
I have 3 boys.
3 boys. That explains a
Yes.
lot, doesn't it?
It does.
And she lived to
Explains
tell
the
about
bags
it.
under my eyes now. Love the boys. We're doing baseball like crazy right now, and Carson's home from his first year at Finley.
Okay. Oh, he's up at University of Finley?
Yep.
Okay. All right. Robyn, how about a little bit of your background?
Yeah, so I'm the wellness coordinator at the hospital. I've been there almost 7 years this fall. And so I do a lot of community health programming. I get to go out and talk to people about various topics. I am a part of the community health needs assessment. And then I also do teach different classes for the community, whether it's a fall prevention class, a strength training program, etc. I get to be involved in a lot of those areas.
Okay, and then your background.
So I'm from northern Indiana originally, met someone local and came back and we got married, and now we have 2 boys of our own, and we show pigs and are on the farm and just a little bit of
You
everything.
probably never dreamed growing up you'd be raising pigs, did you?
Not the pig part. I was raised by a farmer, so I
Okay.
understand that part, but not the pigs. So. But it's been a lot of fun.
Okay. We're going to talk just a little bit before we get into some of the events and programs you have going on right now. A little bit of the history of Wayne Hospital and Wayne Healthcare. It's over 100 years old, correct?
Correct. Yeah, we had our centennial in 22, so that was really a fun time. That whole year we celebrated being 100 years old. So yeah, we've been around a long time. It's been on the same site the entire time, just has grown and changed over the years where we've added on, and they took the original house down in the 70s, I believe, is when they took that house down. So it's got a rich history, and we've always been around to be here for our community.
Ty, were you born in Greenville?
Yeah, Wayne Hospital.
Wayne Hospital.
Yeah.
We're older than dirt, so that,
Yeah.
that kind of explains that.
Not quite
That's
100
right.
years ago.
Not quite 100. but-
Almost, right?
Yeah.
Combined time,
Yeah, come on, yeah. So you were born at Wayne Hospital.
Yeah.
Of course, you were Northern Indiana
Yep.
girl. Were you born at Wayne
I
Hospital?
was, yes, I
Okay.
was.
Huh. Yeah, I was born in St. Louis, so I don't qualify. So
Yeah.
not quite a native yet.
We were bored, Katie, right?
Yeah, and you've added on quite a bit from that
Yes.
original house you talked about, and then the hospital, basically, and probably even you were born in before they added on a lot to it.
Yeah, so my year, I was born in '79, and I think they did have the annex then,
Okay.
which was supposed to be a temporary annex that they put up in the '70s, and that we just, with the expansion in '21, took down.
Yeah.
So that was a long temporary building, 50-some years, you know. But yeah, it was original, you know, it was not new. We have that beautiful new Special Beginnings obstetrics unit now. It's gorgeous. We've got a wonderful place to have babies, and it's very comfortable for families. And I would say, Alex, you know my mom, so she would always tell the story. I was born in August, that I was born and the next day was the hottest day of the year, and there was no air conditioning in that unit then, and like everybody was passing out. So I get to hear that every year on my birthday. But we've come a long way from
Yep.
there, and the hospital is beautiful and state of the art. It's great for our
And the new
community.
addition behind the main building then, Robyn, is that where you kind of hang out?
I do. I love it in there. So like Lauren said, part of it is the new obstetrics unit, all new private rooms. The other part, another part, I guess, is the wellness center, which is where I get to hang out. That's where my office is. We have a brand new 10,000 square foot gym, cardiac, pulmonary rehab, other community programming happen in there. And then up on the third floor, we have private rooms.
Okay. Yeah, so we've got this facility, the main campus. What are some of the other outliers that we have as far as in
Satellites.
different communities, the satellite offices and so forth?
So we have our primary care offices there in Greenville and in Union City. Those are beside the hospital there on the north side. And we have our Wayne Surgeon's office over there, our women's health care services over there, so our gynecology and obstetrics, they're all over there. So we've got walk-in care, we've got the surgeons, we've got the women's health there on the north side of the hospital. And yeah, we've got Union City primary care, our outpatient rehabilitation, physical therapy, occupational therapy, speech therapy, that's down the street there on Schweitzer, a little bit to the south. So that's there.
Cardiology.
The cardiology office, we've got that, that's newer. So we employed Dr. Doolin as our cardiologist a couple years ago, and Brandon Bikey is now our PA for that as well, so that's been a great addition.
Do you also have the dialysis?
So the dialysis center is not ours.
That
but
is
we
not
send-
yours.
Correct, but we send people to that and refer people to the dialysis center. And same with the cancer center down there. It's more of a partnership. It's not actually ours, but it's a partnership to send people down there to do their infusions, their chemotherapy, their radiation.
Now, is Wayne Healthcare involved or tied in with like Premier or Kettering or any of those networks?
We have tons of partnerships. So we are not owned by any of them. We're still our independent rural hospital, but we do have a lot of partnerships. We have business partnerships with Premier and telehealth. We have anesthesiology partnerships with Kettering. We have partnerships for radiology and imaging with an organization called Regional Imaging. We have purchasing partnerships and some other things with Ohio State. So lots of
So you're
lots of
independent, but yet.
Correct.
Yes.
Okay.
So do you
Correct.
contract those services or that sort of thing? Is that how it
Yes.
works? Okay.
Yep.
Yeah, okay. And then, Robyn, what, when you talk about your healthcare and wellness and so forth, a lot of different programs involved in that, correct? You
Yes.
want to mention a few of them here? Because we're going to
Sure.
get into a lot of
Yeah.
this stuff here in
Yeah.
a little bit.
So some of the programs I teach on campus, we also have a mobile unit, or a van you might see rolling around town. So we're able to take things out to people, whether that's a screening or an education, and that can be whatever people want. On campus, though, I teach a few different programs, one being Stepping On, which is a fall prevention program. This is for older adults who have a fear of falling or might just want a few extra tips on how to stay safe and age well in their home. So that's been a lot of fun. Myself and one of our physical therapists teach that class. I also teach a Tai Chi class. Lauren's also getting her certification in that, so we can provide more classes to the community. That is for people who are sedentary and might want to get started exercising, or they have arthritis or don't really know where to start. This is a nice, gentle way to get back into that. In addition, we're getting ready to start in the late summer here a program called Jerry Fit, which is a strength training program for older adults as well. We know that as we age, we lose muscle mass at least 1 to 2 pounds a year, and so if we can prevent that by providing a strength training program, we're able to strengthen and then hopefully decrease falls and improve balance. So that's been a really fun one. We've been just starting to get certifications for. We actually got a grant through the Area Council on Aging for that, and so we've able to get that evidence-based class as well. All of ours
How
are
do people get in
evidence-based.
touch with you for some of these programs?
Yes, so they can either call into the hospital at our main number, or you can call me directly. My phone number is 937-569-6504. You can see it all over our website or social media. It's usually displayed quite prominently, but if you give me a call, I can get you pointed in the right
Yeah,
direction.
and we'll have Nick put that on at the end of the
Right.
program so people have a chance
Website,
to
or,
look at that.
I know there's
Perfect.
advertisements you put in the local
Yes.
papers and stuff all the time.
Yeah.
Yes.
As well.
Quite a bit that
For
way.
those that aren't necessarily computer savvy or something, especially the older clientele anyway, right?
Our newspaper is still the best way. Most of my people, at least, get
Yeah.
to me is through the newspaper. So.
So your wellness program, then, a lot of that's preventative, getting ahead of the curve and so forth, correct?
Yes, because we believe at Wayne Healthcare prevention versus treatment. We want to try and prevent or delay disease as much as we can and try and give people the best start or the best opportunity to continue living an independent, healthy life. And so by doing that, we're trying to get ahead of that curve.
Do you do a lot of work with BOSU balls?
I don't personally, but I do like them. I know our physical therapists down the street use them quite a bit. But I will say they also have some in the Wellness Center because we do a Parkinson's program. We partner with our outpatient rehab team for that, and they come down to the Wellness Center. So we do have some down there.
Yeah, I know. I work out at SNAP with BJ Paulus, and when we first started, I hated the BOSU. I just hated the BOSU ball because I thought, like Ty, we're fairly coordinated. All of a sudden, I'm falling all over the place. Now I love the BOSU ball.
It's
The
challenging
BOSU
at
ball's my
first.
friend.
Yes, it's fun. Challenging but fun.
It's a lot of fun.
Yeah.
Let's talk about some of the things. You have a lot, my gosh, all the events and different
Yeah.
things coming up here. So let's talk a little bit about what we have coming up here within, say, the next month or two.
Sure. Lauren, you
Whichever one's taking.
You want to start first?
Sure. So I think our biggest event that's coming up, want to give a plug for our breast cancer awareness of Darke County, the BCADC. The race walk that is huge, that is downtown Greenville here, will be coming up in July. And I've got a little information on it here too.
Does that tie in with Annie Oakley weekend?
Yes.
Yes, okay.
Yes, it's the
always the
same
same
I
thing.
always see
weekend.
the ribbons out on the,
Yep.
Yeah, so we started up here, down here kind of at the Annie Oakley statue, and it's on July 26th this year. 5K run walk. They'll start it there, they go all through, down through the park and back up here. And then they go to Dave Knapp afterwards for an auction and another, just kind of a follow-up event, talk about the awards, who won the race, things like that. And it's their big fundraiser for the year to help with breast cancer. So it is a great event. The impact of it helps with mammogram screenings, ultrasound testing, you know, trying to detect breast cancer, helping with wigs, prosthesis, those undergoing treatment, just giving them those different tools that they might need, and a lot of different surgical supplies. Biggest thing, financial assistance, because we all know that cancer is a huge burden financially.
Do they still have the guys dress in pink? Because I'm not so sure
they-
that's politically
They
correct
haven't the
anymore.
last couple of years.
they can't find the
Haven't,
guys.
but
Hey, anything going on then?
we did not have them last year. We are trying to bring them back this year. Not having them necessarily dress in women's clothes, more just like a pink T-shirt or a breast cancer T-shirt, and then walking that way.
It's a lot of fun trying to see these
Yeah.
guys walk with high
Yeah.
heels down the middle of
We're trying
Broadway.
to prevent some achy feet afterwards.
Yes, that's
so-
probably a
Some more
good
injuries
idea.
on the way.
Yeah, yeah.
But it was a cute idea, walk a mile in her shoes, just to kind of show, you know, the hardship of breast cancer.
Well, let me pull some stuff out here because they did a great job of putting together
Sure did.
what Robyn does and what Lauren does here and so forth. So we'll just kind of pick and choose some here and let each one of you talk a little
Sure.
bit about this. The Diabetes Wellness Program, how's that work?
So that is taught by our diabetic educator and dietitian, Karen Dresch, at the hospital. It's a free program for anyone, not just with diabetes, but maybe just wanting to learn more about overall nutrition. She does tie in diabetes information there, but it's just good information for anyone. It's completely free. It's a monthly program. She goes over different topics. I think this month coming up is navigating social situations with diabetes. So we know a lot of times, especially summer, you go to parties and there's a bunch of food. A lot of it's sugary desserts or drinks. And so how do we navigate that and unhealthy foods with diabetes and still getting what you need? So she does a great job of laying it all out for people and answering questions.
Have you noticed an increase in diabetes here in Darke County, for
Yes.
example?
Yep.
Yeah.
Yep. She's been increasingly busy over the years with referrals and things. She not only sees diabetic patients, she'll see women with gestational diabetes, cancer patients who have just been diagnosed, and how that nutrition plays a role in their care and their overall health, and then just anyone who gets a referral from their doctor for just a general dietitian consult.
Okay.
And the one on here that I see is the vascular screening, kind of near and dear to my heart.
Yeah, so that's been a great program with the foundation, and it's near and dear to my heart as well. Right now, we have an initiative called the Bob Mankey Heartwise Initiative, and that is helping fund that program so that we can do the vascular screen. It's a 3-part ultrasound to look and see if you are at risk for stroke, heart attack. Is there thickening in those arteries? What's going on inside? And is your ticker healthy? So it's a very important program. We started it at the foundation with a walk that we used to do. Midmark was hugely vital in starting this with us. Mitch Eiding, I give Mitch a huge shout out, was very, very helpful in this with us. But we started with a walk so that we could discount these vascular screens, because they were about $50 out of pocket to do, which is still discounted from what they actually
Right,
cost. But a lot of people in the community weren't taking advantage of it. And so we started this walk, and we were able to discount those by close to half. And it's been a great help. I know we've done probably close to 4,000 screenings since we started doing this. I bet they average 20 to 30 a month that they do. It used to be maybe 2 or 3 a month. And 1 in 3 people usually come back with something where they need follow-up. They didn't realize something was going on in there and they're at risk, and now they can have a better outcome for their future and can get with the cardiologist or their family doctor and say, okay, here's where I'm at. How do I keep my heart healthy? What do I change? Are there different, things I should be eating? All of those things, blood pressure medication, things like that. So the vascular screening program is a fantastic program. It came about because Bob Mankey, he was an engineer who worked at Midmark. He was out running one day, training with his daughter Lauren. She was getting ready for cross country for junior high. And they were out running, and they came home, and he collapsed and sadly passed away.
He was in his, late 40s?
30s.
Oh, he was in
late
his 30s even.
Yeah, he was
Wow.
Yeah, another
38.
young man.
Yes, he was 38. And there's a video on our website on the foundation page, waynehealthcare.org/foundation, a phenomenal video, and I encourage everybody to go on there and watch it. Lauren speaks. She is now in her first year, getting ready to go into her first year of medical school. So she went to Case Western, and she wants to be a cardiologist. So, I mean, what an amazing story. Very impactful when you're in junior high and you lose your dad and you witness that. I can't imagine what she went through, and that could go a lot of different ways for a person. And she's out there just wanting to give everybody a better outcome, and it's inspiring. So they have been a huge drive behind that vascular screening program. And heart health, when we talk about the community needs assessment, is always our #1 cause of death. It's always one of the biggest things on the community needs assessment, where we all need to do better with our heart health, know our numbers, be preventative about it, those types of things.
Now, I know both of you are basically goodwill ambassadors, and you're kind of the faces of a lot of the stuff that goes on at Wayne Healthcare because, like you say, you have is it a monthly or weekly program with WTGR?
Monthly.
Monthly.
Yeah.
And now, Robin, I see here then, I assume the corporate wellness and health
Yeah.
fairs, so you're out in the public eye quite a bit, giving
am.
talks and putting on programs, correct?
Yes, yeah, which is a lot of fun. I get to meet a lot of different people, get to try and create a lot of different programs for people. Everyone's a little different in what they want and what they're looking for. So we're trying to kind of get that corporate wellness program up and running, bring on more partners so we can make our community healthy by partnering however our companies or manufacturing institutions want to do that.
And again, if they want to get in contact with you, we'll have your phone number
Right.
on at the end of the show and
Or
so
the
forth.
website, I suppose, that-
Yes.
as well.
On the website.
Yeah.
Another thing that always is a big event is the golf outing, and that's
Yes.
coming up in August.
September.
Close enough.
Yeah.
I'll be there early.
Be here.
You can be
practice
there.
round.
Yeah.
You can practice a little bit. You might need to take me. I need practice right now.
Let's talk a little bit about that.
Yeah, very exciting. We're getting ready to plan that and have information probably come out the first part of July about that. But we are going to Stillwater this year. It is on Monday, September 22nd. We believe that tea time is going to be a 12:30 tea time. And it is always a really big event for our foundation and to help fund all these programs we're talking about. We have a lot of fun. We do a lot of games on our holes and we tailor them a little bit more to the hospital. So they're kind of creative. We do typically have the cannon out there. We've had that the last couple of years. That's a ton of fun as well. But
Got a
we've got-
triage hole. Yeah.
well, we have something that's very close to a triage hole. So yeah, we did a centennial hole, and so we're bringing the hospital centennial hole back. We've got a few tricks up our sleeve that I think people will have a lot of fun with. But yeah, we'll have that information coming out here within the next month.
And that's for the foundation.
And that is for the foundation.
When we
yeah.
talk about the foundation, what happens to all the monies that come in? How's that distributed? What's it used for?
Yeah, so our volunteer board of directors does a great job with fiscal responsibility with our donors' dollars. And we have a scholarship program, so we just got done awarding scholarships to seniors in our community and also to those who are collegiate and going on in their medical studies. We have our AED program. I should have brought an AED today and didn't think about it, but we have the automated external defibrillator program. So our nonprofits can, they can apply and we can put those in their places, and we work with Spirit and Midmark on that. Spirit does a lot of the CPR and first aid training on those. But it's great to have those. We've put those in schools. I think we've got about 300 out in the community right now. And that's, at least 10 or more people probably trained on them at every location. So that is wonderful to have that out there. But we put those in schools. We've got those with sporting events, with the parks, with churches, just all over the place. Our EMS teams, our volunteer fires, a lot of those places fire sheriffs, those types of things.
Was that brought about
yeah.
by the Williams boy
Ours
from
was,
Union City, or is that a different group?
theirs is different. They do a lot of the baseball and recreational
Okay.
youth sports,
Okay.
and that is the Dylan Williams Fund is a wonderful program.
Yeah.
Carson was around Dylan's age and played against Dylan when they were younger. And so that's just also a very, very great program.
Robin,
Yeah.
do we still have, because I know we've brought a lot of local people back, have gone to medical school and so forth, do we still have a program, in addition to the scholarships, where we encourage some of our high school students as they get into the medical field, do we still bring them back through the hospital, through Wayne Healthcare? Do we have something still set up?
Yeah.
So we're working with our HR team to develop something like that, but we do have students come in, they can shadow, and there's different days throughout the year that we have people come in, students come in, observe, ask questions, see the different careers that are available. In addition to that, we also go out into the community at different events like STEAM and STEM
Right.
events.
Right.
So we do have an impact event usually.
Tell people what STEAM and STEM.
Yeah.
So STEM and STEAM are the careers in the math, engineering, technology, science fields. So that is why we try and get as much publicity in those areas so that people are aware of what all the hospital does. There's a variety of things that can be done there, not just your traditional doctors and nurses.
Right.
So we try and get those careers out to people so that they know that there's other things to go into medically than those two more popular careers. So STEM events, we have one in the spring that we usually go to. It's a women's event for high school seniors out at Birchwood. We do one at Edison State in the fall, and then we actually host one through the Darke County Economic Development. So that's getting ready to come up here in July.
Okay.
And that's a big thing, the Darke County Development have the programs they do have, that they bring different companies in, and like you said, there's different things. You think of a hospital, you think, a doctor or a nurse, but there's things like you folks do, right?
Yeah.
Oh,
Do
yes.
that. And there's things like purchasing, logistics. There's a lot of things that you don't think about that make a hospital a program tick, management, different
Yes.
administrative things, so.
Even the
Absolutely.
non-medical.
Right,
Yes.
exactly.
Yes.
So those are great programs.
Yeah.
Yeah, and we have our Wright State Rural Residency Program with
Okay.
the doctors too, to bring that back in and kind of be that teaching hospital for that as well. So that's been great. And I get a lot of my scholarship kids that, I should say adults that, get back with me. They want to come and shadow, over Christmas break, or they want to come work over the summer. We had an orientation group start Monday, and I saw one of my past scholarship individuals is going there, and I know he would like to be an orthopedic surgeon at some point. So it's fun to see that, but there's a lot, we touch a lot of different lives with these programs, and so sometimes it's hard to keep up with where everyone's at and where they're going, but definitely love it when they come back here.
How's staffing right now at Wayne Healthcare? Are we short-handed in certain areas, or what would you like to see come in that we don't have at the present time? The recruiting's always going on, I'm
And then
sure of
some-
that.
And some
then-
challenges you have
Yeah.
currently or you see in the future.
Yeah.
I would say staffing is pretty steady right now.
Okay.
After COVID, it was tough. We saw a lot of issues where we had to use a lot of travel and agency. It was hard after COVID. People were retiring early. People weren't necessarily coming right back into that clinical workforce. It has become steady now, and it's much better. Now, with a hospital, census is always different. So you never know day to day. You have to staff towards a model. But some days you might have to flex up, and some days you might have to flex down. So we are always prepared for those types of things.
How's that work? You talk about the census and so forth. There's a lot fewer days spent in-house
Yeah.
compared to outpatient now.
Correct.
How's that in dealing with all the insurance companies? Does that drive you crazy?
Well, not us. We don't do
No, I know, but in general,
Yeah.
It is always a challenge,
Yeah.
Alex. It's always a
It's always a
challenge
challenge.
for management and that team. Definitely, everyone's insurance is a little bit different. Everyone's body reacts to what they get done differently. Surgeries obviously are a lot more outpatient, which just with our robotic surgeries and things too, like recovery is much
quicker.
usually. Not for everyone, but usually. And so, you just always have to know we have great case managers, we have a great clinical team, that we have great navigators that navigate, your insurances and everybody's, how long someone can stay for something, because it's all different. It is all different.
Now, are some of your programs covered by insurance then, Robyn, or is that out of pocket?
Majority of mine are self-pay out of pocket.
Okay.
Now we do try and keep costs low or no cost at all for these programs. We truly want people to be well, be healthy, and take ownership in their health. And so, excuse me, we try and eliminate that barrier for people.
That's why the fundraisers and things like that are
Yes.
so
Yes.
important to
Yeah.
If we
support
do-
the community. Yeah.
Yes, yep. And if we do have a charge with it, we do partner with the foundation. Lauren and I work very closely.
Yeah, we do.
And so if there is a charge and people can't pay, we do have a scholarship program we can apply for, and the foundation can help with that.
Yeah, and I would say you talked about like something we wish we had here, a service line, urology. Urology is huge. We would love to have a more robust urology service line in our county. We've got, an older population. It is a huge need. So that's something we're always trying to work on, but
Yeah,
it's
some of the
hard to get those
specialty
docs here.
groups, yeah, some of the specialty groups are really tough.
Challenges from a standpoint, what do you see currently? Do you see a challenge maybe the public doesn't know about, or things that you see coming down the road that could be a challenge?
We always watch, we are heavily Medicare funded because of the age of our, county. And so we're always watching, hey, Mike. We're always watching, those grant dollars, what the government's doing. We heavily rely on Medicare. Private insurance is probably about 15% of what we do. Medicaid might be just about 5%, but Medicare is 80%.
That's the
So
type
we're-
of population
Yes,
you're dealing
yes.
with. Yeah.
So we're always kind of watching those trends. How can we help them? If there's different plans that come out or supplements, that health literacy, we've noticed, and we've seen that with the community needs assessment, health literacy, understanding your insurance with Medicare, we want to do more programs on that and help with that because we see that as a gap in service. Sometimes people think they have something that's covered and it's not. And then sometimes that's where we're like, well, can they afford it? Can the foundation come in to help pay for it? We always want people to get their services, so we want to eliminate those barriers to care as best we can.
Sure.
What
We
do
see
you-
transportation
yeah.
as an issue
Yeah.
too.
Yeah,
Transportation's a big issue.
But we're
Yeah.
trying to combat that with our wellness van. We have a mobile unit, so we are
Right.
able to go out to places. So trying to take those preventative services and education out to patients, so they might not be able to get to a primary care doctor, but they have a general idea of what their health is, what their numbers mean, and then they can hopefully get those services if needed.
Yeah, and we have a foundation program that helps with transportation too, and we work with GTS here in town and in the county and Spirit when needed as well for that.
We've been hearing a lot about some of the legislative programs that have been proposed or coming down the pike here and how it will impact rural hospitals. Now, I don't really think of Wayne, I mean, yes, rural setting, but we're a lot more than just a small town hospital.
do more than deliver
We do
babies,
a
right?
lot
We
of
do.
different things. Is that gonna have any kind of impact?
We are small but mighty,
Yes.
so I think all impact's going to have an impact on us in some way, shape, or form. So just kind of being cognizant of what those look like and trying to set us up for success the best we can.
And I think our partnerships, that's something we've done well for the last 25, 30 plus years at our hospital. Our last 3 CEOs were really great at managing money, at leveraging partnerships, at bringing those things here so that we aren't just, that small rural hospital. We can provide a huge service line to our
Yeah.
community and keep them home here.
It always bothers me sometimes when I hear some people say, oh, Wayne Hospital, I don't know if I'd go. I tell you what, Wayne Hospital's a tremendous asset to
Yes.
West Central Ohio. You folks do a tremendous job out there, and when I hear
you.
people
Yeah.
say that, I just want to slap them silly, to be real honest.
Yeah.
Throat punch somebody.
Yeah.
Well, we don't promote, violence here, Alex, so,
I'll give you more business.
If you want to come do some Tai Chi, we can get some movement out of you. Then you'll feel a lot better.
Anyhow, anything you folks want to bring up that we haven't kind of touched on? I know we're going to be limited on time here, but
There's so many
anything else?
programs they have.
Oh, yeah.
Yeah.
You got to go to the website or certainly contact these ladies because so many wonderful programs and there's so many ways that you can help. So with programs coming up and things of that nature. So
Anything,
Yeah.
last minute things you want to touch on here before we wrap things up?
If you, just in this program or in general, if you've heard something that kind of piques your interest, please go to our social media, whether that's our Facebook page or our website in general, or look in the paper. We always have events coming up. We always try and advertise and communicate as best we can, so please go reach out to us. My phone number, 937-569-6504, or you can get in touch with Lauren, 937-547-5715. We'd be happy to get you connected.
Okay, Lauren, anything?
I think that kind of wraps it up. I mean, we have so many programs, and we've got a lot of ways that people can get involved, volunteering,
Yes.
donating to help with these. So, if you want to donate, if you want to get involved, give me a call, and my phone number too, we have the scheduling phone number if you want to schedule for the vascular screens as well, or you can call me and ask questions too. So the other number is 937-569-6408. So any of those numbers, again, like Robyn said, go to the website. There's lots of ways to get in touch with us, get involved. I think our email addresses are on everything we have out in the community as well. So please just get involved. We have a great, robust cancer care program too. And I know we haven't even touched on that, but anyone that has questions about that can call us as well.
Well, we certainly thank you too for stopping by today.
Thank
I
you
know
for
you always
having
have
me.
busy
Thanks.
schedules and so forth. This has
Appreciate
been
it.
Robyn Feitshans and Lauren Henry from the Wayne Healthcare. And again, you guys do such a tremendous job, and we are
Thank
so
you.
blessed to have Wayne Hospital, Wayne Healthcare here in Greenville and Darke County, as well as West Central Ohio. So thank you so much for stopping
guys.
by.
Appreciate it.
Thank you.
Yes,
So,
guys.
and Mike Stiegel just walked in. Mike, you didn't
Hi, Mike.
realize today's National Donut Day, so we thought maybe you were late
Getting
bringing
donuts.
donuts to us.
That's the reason I'm late, I was eating donuts.
I thought you were stuck in line at Eikenberry's. Anyhow, on behalf of Nick Schmidt, our videographer, Ty
Nick.
House, Alex Warner, thanks for tuning in. We'll see you next time here on another episode of the Roundtable here on mycountylink.com. So long, everybody.